Hi, I'm Belinda Vail, Chair of Family Medicine and Community Health at the University of Kansas, and welcome to our first video blog or vlog. I have a couple of shout outs at the beginning here. First, a shout out to internal medicine at KU who started the vlog episodes. And then second to Jeffrey Field, who's videoing this and making a great production. He also does our production of our monthly newsletter. So our newsletter has been mostly about the department, what's going on in the department, and features some of our individual employees and physicians, residents that are in the department. So we wanted to do something a little different with our vlog. So we wanted to start this month with something on sports. We finally have sports back in our lives and on television. In Kansas City, we have the Chiefs, the Royals, and Sporting. And so since we have a connection to the Chiefs and the Royals and to high school athletics in the community, we thought we'd feature those things this month and let everybody know kind of what goes on inside the Chiefs and Royals and how they're dealing with COVID.
My name's Joe Nolan. I'm one of the physicians here in the family medicine department. My clinic is at KU Med West. I'm the head medical physician for the Kansas City Royals. We actually were covering the Big 12 men's basketball tournament at the time that everything got closed. And so we started to get some information from MLB that things would get closed. And then really no information came out for a while. And then we started getting information that it's likely we're going to at least have some type of season. And before anything even really emerged as far as what that season would look like, they wanted us to start putting protocols together. We tried to kind of focus on certain things. Education of our players and our staff and all the front office people as to what this virus was and how to protect yourselves from it, signs and symptoms of it. Isolation, so we isolated people in certain groups. We didn't want the whole team to come work out together. It was certain groups that way if somebody was positive, we could contain it within that group and we knew who to continue to monitor. And then prevention, of course, was a big one as well. The day-to-day really was like every other place, masks. We had a lot of social distancing. We tried to keep groups of players together in certain workout groups so that we could protect everybody. We talk about NBA having the bubble, and really we had a bubble too. Our bubble just traveled. The MLB players they travel in charter planes. Well, definitely at this point we travel that way, and they all get on the same bus. They all travel together to the hotel. They're not allowed to leave the hotel. So their bubble in Cleveland was the same as their bubble here. We're not letting you go out and interact with the fans. We don't want you to go to restaurants and casinos and whatever else may be out there. It's really stay within your group. Don't leave the hotel unless you're going to the park to play. From the Royals standpoint, I think we were successful and really lucky because a lot of our positives were early. And then through the season, we really had a lot of good success from that standpoint. The early positives, those that hurt us on the field initially, but truthfully, I think we handled it well. We had a good team as far as the medical team, and we kind of made decisions and adjusted our recommendations based on local and CDC guidelines, and it was overall a good result.
My name is JP Darsh. I'm one of the family medicine physicians here at KU, and I do also sports medicine, board certified sports medicine specialist. And part of my role here is I'm one of the team physicians for the Kansas City Chiefs. I think the NFL had a bit of a benefit of watching and seeing what happens with baseball, basketball, hockey, and then there was trying to learn, talk to everybody, talk to the experts, and figure out how we're going to make this as safe as possible. And the NFL itself came up with a really good protocol, and it's been pretty successful. Players get tested extensively, basically every single day, and including the staff. And there's a lot of limitations as far as who can be where, and people inside the building have to wear a monitoring chip so they can look back and make sure you're not in an area you're not supposed to be, or around other people you're not supposed to be around. And the whole purpose is to keep the players isolated and not be a contributor to the community spread of COVID. So every player gets tested every single morning, as well as anybody that's in direct contact with players. They get a daily, in the morning, they get a nasal swab, and this gets sent out to a lab that a few of the teams use together, and this is all managed by the league office, the NFL, and the test results are always back by the next morning, within 24 hours or roughly. And it allows, again, it's not in real time, so there is a blind window a little bit if you want, but that's, and if there's a positive, there's a whole protocol to go to confirm that it is a positive test. And so far it's worked fairly well. I mean, there's been a few hiccups recently, but for the most part, I mean, there's a lot of people putting in a lot of time and a lot of hard work. So as of now, I think it's been fairly successful.
I'm Dr. Nicole Jedlinski. I'm one of the family medicine and sports medicine docs here at the University of Kansas Medical Center, and I am the team physician for Lansing High School in Lansing, Kansas. So one of the ways that we're dealing with COVID when it comes to high school athletics is by making sure that our athletes are staying as safe and socially distanced as possible. Any athlete with any symptoms is tested and quarantined until they have their test results. Especially when it comes to spectator sports, we are keeping our numbers down in terms of the number of spectators that are allowed to attend any of our high school athletic events. We're also, even in football, keeping our athletes as socially distanced on the sideline as possible. So at Lansing High School, every football player is given a disc to stand on. We're not sharing any water bottles. Each athlete brings their own water bottle. And then for on field, we're using disposable water bottles for the athletes. And then obviously, athletes are being asked to wear masks whenever possible when they're not actively engaged in playing. I wish I could have a crystal ball and be able to predict how athletics are going to go in the spring. I tend to think that sports that are played outside and can be as socially distanced as possible are a little bit safer. So things like track and field, tennis, those sports tend to have just a lower risk of exposure versus, say, basketball or wrestling, where you have a lot of athletes in a small confined space and it's really hard to socially distance when it comes to those sports. I think at the end of the day, the student athletes just want to play, and so they're really willing to be as safe as possible as long as that allows them to play. And so they've been great about adhering to guidelines and really just going with the flow.
Thanks for watching our first vlog, and next month we hope to see you back again when we're planning to do an episode on the holidays and how to celebrate those safely in times of COVID.